Welcome Dr. John Stewart to our series From the Frontlines video interviews for the American College of Surgeons ACS Bulletin Brief. I've had the pleasure and privilege of working with Dr. Stewart on the Communications Committee since the inception of that committee at the beginning of the COVID-19 pandemic. Dr. Stewart is the chair of the Advisory Council chairs. He's in that capacity as the chair of the General Surgery Advisory Council. Welcome, Dr. Stewart.
Thank you.
Let's start out, John, because I don't think everybody is fully aware of the activities of the Advisory Council. So perhaps you could start out as the chair of the Advisory Council chairs to describe for our listeners and viewers, what are the Advisory Councils, how many Advisory Councils do we have in the college, and what is their function?
So there are presently 14 advisory councils for surgical subspecialties to actually enhance the college's relationship with those specialties and enhance the communication between the Board of Regents and the various specialty organizations. And so the 14 specialties are represented by an advisory council, and there is a Board of Regent or a regent of the board who serves as a liaison to those councils.
And how are people selected to serve on advisory councils? What are the lengths of terms?
And so the advisory council members are elected to 3-year terms, and those and they actually represent surgical specialty societies. So for instance, when I was elected to the to the Advisory Council for General Surgery, I was a representative for the Southeastern Surgical Conference.
In a typical advisory council, take general surgery, for example, what are the issues that would be dealt with, that would be brought to the advisory council? And perhaps you could paint that in the context of other groups within the college, because I've had people ask me, okay, you're regent, we understand you're looking at the overall college, and you're fiscally responsible for the college, the stewardship of the college. Then there's this board of governors, right? And then there are advisory councils, as well as chapters. And perhaps you could help our fellows and non-fellow listeners and viewers understand a little bit about the structure.
As I mentioned before, the advisory councils actually communicate and help advise the Board of Regents. Important aspects that we discuss are things that are germane to our particular specialty. So for instance, in general surgery, we discuss have discussed important issues, including advocacy. We actually had pretty robust discussion around the surgical home when that was a very active issue. We talked about things such as decoupling the global period. And so things that actually impact our fellows are discussed at the advisory council level. As I said, we have communications with the Board of Regents. We have a Board of Regents liaison that comes to our meetings. And so this establishes a nice two-way communication, because we also have guests from the various functions of the college attend our meetings that happen twice a year. Those meetings happen either at the clinical congress, and typically in the spring, we have a meeting at the leadership conference, although some advisory council members have obligations related to their specialties for larger meetings that happen during the spring.
And what's the relationship among the advisory councils? So you're the chair of all the advisory council chairs, and you have more than a dozen advisory councils. So are there some activities, for example, educational activities at the annual clinical congress, that might be the work product of several advisory councils or two or more working together?
So we have actually set up a structure that mirrors the pillars of the governors. And so we have an education pillar, we have an advocacy pillar, we have optimal patient outcomes pillars, and others. And we actually have the leaders of those pillars from each advisory council meet at least twice a year to discuss issues that are germane to all the advisory councils. A more recent effort to form a more cohesive link between the advisory council and the governors is that we had actually planned to have joint pillar meetings during this past spring. However, those meetings were canceled due to our COVID crisis.
Tell us a little bit about some of the specific activities. Maybe you could, you've spoken in general terms about the pillars and the relationships among the councils and such, but maybe you could tell us some success stories, some things that under your tenure or prior to your tenure as chair of the chairs that happened in the advisory councils?
One thing that we actually were able to accomplish over the past year was to set up an advisory council foundation challenge. We know that the activities of the American College of Surgeons Foundation are extraordinarily important, and these activities are not typically covered by the operating budget of the college. One thing that we decided as leaders of the advisory councils is that it was important for us to take ownership in supporting the foundation. And so last year we issued a challenge with respect to having each advisory council member contribute to the foundation. And so the advisory council with the highest rate of participation actually was recognized at the Clinical Congress meeting in San Francisco. Fortunately, our newest advisory council, oral maxillofacial surgery, actually had the highest level of participation. So again, that allows us to have, to exercise our leadership roles in supporting some of the operations. Other things that we do during the year is we have significant input into the program of the Clinical Congress. We actually have, each advisory council has a program liaison, and we also submit abstracts or suggestions for abstracts through the advisory councils for the Clinical Congress.
Okay, and I'm seeing some very successful multidisciplinary panels. I know that the program committee tends to like those panels, and it's a great chance to get together with people from other specialties with whom we wouldn't necessarily share educational content. Can you give us an idea of how, say, a fellow has an idea for a session? Okay, somebody who's in practice somewhere and says, you know, I'd really love to hear about this. I put it on the questionnaire last year, or somehow I never heard back, so I want to send an idea. How would somebody go about doing such a potential implementation of educational content?
I think that there are two ways that occurs. So one is through relationships that some of the advisory council members have with each other. So for instance, I think it was this past fall, we started having discussions around having a panel on the regionalization of healthcare. And so this was something that was important to the general surgeons, but it was also important to the Advisory Council for Rural Surgery. And so we had significant discussions around how we would submit a co-sponsored abstract that focused on regionalization of care. Interestingly, a panel, that same concept was in a panel about 5 years ago. We do recognize that healthcare has evolved significantly over the past 5 years, and so we felt that that was due. The second way that joint sponsorship of a panel might happen is that during the review process, if two advisory councils submit ideas that are very similar, the program committee might suggest that that the submitters or each advisory council come together to join the abstracts to come up with a cleaner program suggestion.
The advisory councils are, in many instances, specialty groups. You mentioned ENT, otolaryngology. From my perspective, there's colorectal surgery. There's many advisory councils. What is the interplay between the respective advisory councils, particularly when it's a specialty advisory council, and the specialty society or societies such as orthopedics or plastic surgery or ENT? How does that interplay work?
Some of that interplay is very organic. We talked about the ability of advisory councils to co-sponsor panels and co-sponsor programs. The other part is when members actually, or advisory councils actually recognize that there are common issues that need to be approached, and we come together to approach those issues. And so that is kind of where we have kind of interdisciplinary cooperation with the advisory councils. I will say that it has been my impression that that the advisory councils have been very active and effective in advocating for things that are specific to their specialties. And so the advisory councils actually serve very important functions in terms of advocating for specialties, but also advocating for cooperation between specialties.
My last question for you is, if a surgeon wanted to get involved in an advisory council, after hearing you share much of the exciting work being done, the important work being done by the advisory councils, how would that person go about becoming engaged?
The traditional way that fellows become members of the advisory council is that they are elected by their particular organization, and so becoming involved in their specialty organization is perhaps the main way to gain membership onto the advisory council.
Thank you very much. I appreciate your time and your insights today, Dr. Stewart. As I said at the beginning of the interview, I really enjoy interacting with you on the communications committee and in the manuscript, which you were tremendously helpful in drafting, that will codify and memorialize the activities of that group in Journal of the American College of Surgeons. But also thanks for all the work you do on behalf of all of our fellows and members through the advisory councils. It's a very important mechanism that contributes to the activities of the college throughout the year. Very appreciative of everything you do. Thank you.
Thank you, Dr. Wexner.